This time on Cancer Buzz, immunotherapy from a different point of view. A patient with metastatic melanoma who underwent one of the very first immunotherapy trials and was cancer-free 12 weeks later.
I always say that your cancer experience, 99% of it takes place outside of the hospital. And I feel like the doctors who understand that and who respect that have the best relationships with their patients.
Welcome to Cancer Buzz. I'm your host, Summer Johnson. Mary Elizabeth Williams is a journalist, celebrated author and speaker, and cancer survivor. She is also one of the very first patients to receive combination immunotherapy treatment for cancer. Her book, A Series of Catastrophes and Miracles, a true story of love, science, and cancer, chronicles her journey with metastatic melanoma and the immunotherapy clinical trial led by Nobel Prize winner James Allison. This is the first time we've had a patient on the show, and you will soon hear why we wanted to bring her story to you. Mary Elizabeth's unique experience with the oncology care team and the clinical trials system sheds light on an underrepresented and evolving population. We talked with Mary Elizabeth about her life-changing experience and current role advocating for the oncology community, and her perspective may surprise you. Walk us through the timeline of that journey, through your initial diagnosis and the initial treatment process.
Sure. So in 2010, I discovered a little bump on the top of my head while I was washing my hair. And a couple of weeks later, it hadn't gone away. So I went to my dermatologist and said, "What's this thing?" And she said, "That looks like skin cancer." And I didn't think too much of it, but she took a biopsy. And a few days later, she called me to say, "I'm so sorry. It's malignant. I've made an appointment for you at Memorial Sloan Kettering for tomorrow morning." So that was the day my life changed. That was the moment my life changed. And I remember very distinctly just kind of sitting with that for a couple of minutes before I made any calls, because I wanted to have those last few moments of being someone who I used to be before I became a person with cancer to everyone who knew me. And I had surgery. I had 5 centimeters taken off the top of my head from my thigh. So my thigh is now on my head. And everything seemed to be going okay. I spent a year as a cancer survivor. But in that interim, my best friend was diagnosed with ovarian cancer. My father-in-law died of colon cancer. And then the following summer, something showed up on my scans, and I was re-diagnosed at stage 4. I had cancer in my lungs and in my soft tissue. And at that point, there were very few options for someone like me. Traditional cancer therapies like chemo and radiation tend not to be effective on melanoma because of the very pernicious nature of that particular kind of cancer. So I knew I was looking at incredibly slim odds. At that point, the 5-year survival rate was about 8%. So because I am extremely lucky and because I was a patient at Memorial Sloan Kettering, my oncologist referred me one slide up to a group of people who were doing immunotherapy. It was the first time I heard that word. And I met with Dr. Jed Wolchuk and enrolled in a clinical trial. I had to go through a lot of testing to get into it, but fortunately for me, I had no other pre-existing conditions. I was in otherwise great health, except for all the cancer. I started on this treatment, and 12 weeks later, I went for my first set of scans, and I was cancer-free, and I've been cancer-free ever since.
What was your initial reaction when your oncologist suggested, "Hey, so there's this treatment, it's new, no one's done it before, so we don't really know what will happen to you"?
I was very skeptical. The only thing that I knew about immunotherapy was just a very short time before the first immunotherapy drug had been approved by the FDA for melanoma. And it was the first new treatment for melanoma in over 30 years. So that had made some headlines. I knew a little bit about it, was a little on my radar. But other than that, I didn't understand the concept of immunotherapy and what makes it different from traditional cancer treatments. I didn't understand how it would be using my body's own defenses to fight the cancer. And I certainly was petrified of the idea of a clinical trial. Absolutely petrified. All of my understanding of clinical trials was that they were a last resort, that they were something that you would do when you had tried everything else, that this was my doctor's way of saying she was giving up on me and she was passing me on to just basically become a medical experiment and maybe be useful to science. That was what I thought. I also thought that I probably wouldn't get real treatment and that I would be given just M&Ms instead of actual treatment. I knew nothing. I had to have a lot of conversations to walk that back, to understand what really goes on in an oncology trial, to understand what immunotherapy did, and to understand why there was reason for hope for me. And the game changer for me was when my doctor said, there's no reason to think this won't work for you. And that was what enabled me to trust. That and the fact that I really didn't have too many other options. If I hadn't done that, I almost assuredly would have died. So that's a really big incentive for somebody to enroll in a clinical trial. And I think for patients who have other options, I can see why clinical trials would be less attractive. But I hope that that's changing because there are so many interesting, exciting, less invasive kinds of treatments going on that I feel clinical trials should be used more as a first line of treatment when appropriate. And so we didn't really know exactly what the side effects were going to be. We didn't know really how it was going to affect me and whether or not it was going to work. But I'm really grateful that I got to be a patient in the clinical trial because I understood that I was going to be a partner in this relationship, that I had a role to play, that I had a job to do, that this was not going to be a passive experience. And I feel that that is enormously valuable to any patient in any kind of treatment, to feel that you have a role and a responsibility and that you are tasked with certain things to do. Because then you're not just a passive recipient. You're not just on the sidelines of your own care. You're really involved in a very active way.
How did your oncologist and cancer care team communicate with you? And then how did the clinical trial team communicate with you? What do you wish that you were prepared for when you started immunotherapy, or could they have told you anything else better to prepare you?
I think that a lot has changed just in the past couple of years in terms of oncology and its understanding of immunotherapy as a viable option, not for melanoma now, of course, for many other kinds of cancers. At the time, it was still kind of a great enigma. I was lucky because I had an oncologist that was working at the facility that was really groundbreaking at this moment in medical history. I had a very nice oncologist. She was all business, though. She was not a super communicative person. She was much more old school, but I trusted her, and I certainly trusted in her ability and her competence. And when she said, I think it's time for you to meet with this other team, I believed her because a year before, when I said, why am I doing surgery and not chemo and radiation? It doesn't really work on a melanoma. So a year later, having that information tucked away, I knew that probably taking that enormous journey, one flight up the stairs, was probably going to make all the difference in my odds. And when I met with the immunotherapy team, I could not have been luckier because I really feel that for the most part, the doctors and researchers who work in immunotherapy are very, very special breed because immunotherapy was sidelined and underestimated for decades, for actually over a century. They have a particular tenacity and patience and persistence that is very, very comforting to a patient. I knew that the people who were going to be on my team, Dr. Jed Wolchuk, under the direction at that point of Dr. James Allison, won the Nobel Prize last year for his work in checkpoint inhibitors, that they really had done decades of homework, had spent years and years and years working in this field, and had a particular kind of faith in what it could do and what the potential of it was, and had a particular skill set in terms of communication and empathy, because they were also working in a field that has such a high mortality rate. I know Dr. Jed Wolchuk had to steer so many patients through end-of-life care that I think those kinds of doctors have a sensitivity and a real understanding of what the stakes are. So I was extremely fortunate. I wish that every patient had that kind of empathy and care and personal investment from their teams. I knew from the outset that I was a human being, that I was a mother, that I was a person who lived in the outside world, outside of that doctor's office, outside of that clinic. I always say that your cancer experience, 99% of it takes place outside of the hospital. And I feel like the doctors who understand that and who respect that have the best relationships with their patients.
We now know that immunotherapy has different effects on the body of the patient, from physical, emotional, and psychological. And you had friends and family going through cancer journeys simultaneously. Were you even able to compare your experience to those, and how were they different?
It's very clear to me, as someone who has never had chemo or radiation or some of the cancer drugs that are more traditional to cancer treatment, what that experience looks like. And I also think it's more understood out there in the vernacular. You know what it means when you walk down the street and you see a woman with no eyebrows and a headscarf, what's probably going on with her, in a way that then might give you more sensitivity to that person. With immunotherapy, the side effects are a lot less apparent to the naked eye. And so that sets you apart in a different way. I had to really sometimes explain to people that I was actually in cancer treatment, that I was a patient, that I might be getting a rash, or I might be short of breath, or I might be dealing with extreme fatigue and some dizziness. My side effects were really relatively mild compared to some of the issues, the side effects that I know, the immune adverse effects that I know other patients have had. For the beginning of the process, really for most of the time that I was in my clinical trial, I didn't personally know other people who were going through immunotherapy. I had nobody else to talk to who was having that specific experience. Because I had loved ones who were going through cancer, we had that common language. But it was only after my protocol was really approved that I started meeting other people who had experienced immunotherapy as well and who had gone through actually my protocol. And that has been amazing to me. It's incredible now as one of the grandparents really in immunotherapy to get to talk to people who are in these second and third waves of treatment and hear what their experience is like and how it is evolving and how the management of it is changing. That's really cool and really exciting. And I'm always, anytime someone reaches out to me in emails and says, I'm going through this immunotherapy, I'm going through this checkpoint inhibitor, to be able to talk to those people, because we're still a small population, and tell them what it's like from the inside really feels like an enormous privilege.
You call yourself an optimist. Was this always a personality trait for you, or do you think it's a result of what you've been through?
I have always been an optimist. I don't know how I managed to dodge the particular bullet of my family history, because I have to tell you, there aren't a lot of them in my bloodline for sure. But I am the person who really desperately tries to see the fullness in any glass. That has really been shaken and challenged. If anything, I feel it's harder now to be an optimist than it used to be, because now I can see how random so much of it is. I know for an absolute fact that I am well based on just a variety of crazy, random circumstances. I know that I am not here today because I prayed differently, or I meditated differently, or I ate more kale than my friends who are dead. I know that all of us want to live. I know all of us are trying our best. I know that anyone who faces a serious diagnosis wants to do everything within their power, and that everyone who loves that person is doing everything in their power. And I know that having a good outlook does not necessarily change your outcome. I hope what it does is it makes the experience more bearable. That's all I can bring to it. I certainly had hope for my friends who aren't here anymore. Optimism didn't change their outcome, but being able to have hope for them in the time that they were here made it more bearable to go through it with them.
You have a unique audience listening here of cancer care professionals, those who have patients enrolled in immuno-oncology trials. What would you tell them about improving the patient experience?
There are so many avenues of opportunity at every single step of the way to improve the patient experience. I would say the first and foremost is just to be clear and direct and empathetic. It sounds really easy. I know it's not, but to take that step back and really maybe run by somebody you know who is not in the field. Hey, here's what I say. Here's the way that I present the information. Would you understand that honestly? As a writer, this is what we do. We ask for editors. We ask for outside readers. If I show my work to someone and I say, do you understand what I'm talking about? And if they don't, then you have to go back and fix it. And I think that sometimes healthcare can really be an echo chamber of experts talking to experts. Our patients who they talk to are really the most educated, the most aggressive and assertive in getting their care, and they really understand everything very well because they have trained themselves to. And the truth is that most of us don't understand, and most of us are also coming into the experience in a place of extreme emotional duress. We're very stressed. We're very scared. And if we say we understand, maybe we don't, because we're just really scared and blindsided and distracted. And it's really important to remember that, and to remember that the person sitting in front of you is dealing with trauma right now, and their cognitive abilities may be impaired, their memory may be impaired. To say things like, why don't you bring someone with you who can write down some notes? Maybe you want to write some notes. Maybe there are some things that you should know that if you want to follow up and ask us, you can call us later. To just make it clear that it's okay to be inquisitive, that it's okay to have questions, that it's okay to take notes, because we're new to it. We've never done this before. We're not the expert. We don't live in this world. We're just visitors to it. And to approach it that way, to approach it with the eyes of the patient who is experiencing all of this for the first time in a really crappy way to enter a new world.
You wrote the book called A Series of Catastrophes and Miracles, a true story of love, science, and cancer, published in 2016. How has your life changed as a result of your treatment? And do you think that writing the book shaped how you viewed your experience and journey at all?
Writing the book absolutely shaped my experience. I actually was writing it. I got the book contract almost exactly at the same time that my best friend got the worst news possible about her prognosis. And the writing of the book really coincided with what was happening in her life. And a lot of it was written very much in partnership with her, and was wanting to make sure that I did right by her and telling her story in a way that was sensitive to her very different experience and outcome. And that shaped me enormously. And I was extremely intentional in what the book is called, because I think a lot of the narrative of cancer memoirs is written by the people who had a happy ending and who had a great outcome. And there's a lot of, I got sick and then I got better, yay me, I'm a warrior. And I don't want that to be the story. I want it understood very clearly that my friend and me, here are two women who were the same age, had really very similar lifestyles and paths, and both got stage 4 cancer and had very different outcomes. It is not based on somebody being better or somebody not trying hard enough. It's so much based on all these other factors. And I said love, science, and cancer because that is the order in which I prioritize those things. And I think, you need a lot of science to get through cancer, but you also need a lot of love. And I have definitely seen that more and more and more over the last few years. And anything that I can do to bring the love into the experience of science, I feel like that's my mission.
How's your family doing these days? Is there any recovery process or any post-traumatic stress that they're dealing with?
I don't know if I can fully overstate the intellectual and emotional impact of serious illness on a family. I am certainly a very different person. I still think of myself as very resilient, but I have a diagnosis of PTSD and anxiety. Those are new to me. I have to take medication now for my anxiety. My younger daughter was 6 when I was diagnosed for the first time. She pretty much doesn't know or remember me as someone without cancer. She has OCD. One of the contributing factors in an OCD diagnosis is childhood trauma. My older daughter certainly deals with anxiety. She gets really scared when I get sick at all. My husband deals with a lot of anxiety, has had a lot of emotional trauma around it as well, and also with the loss of his father to cancer. It impacts us every single day. I mean, when people talk about the end of treatment, the end of cancer, and then you go back to normal, there's no normal to go back to. I feel super lucky because I have resources and I have support and I have the ability to maintain my life within this experience. And yet I cannot overstate the emotional impact that this illness and the grief around it and the loss of the people that we love to cancer have had on us. And in some ways, I look at my daughters now and I see them doing service through Gilda's Club and really working as camp counselors for kids whose parents have cancer as well. And I know that their sensitivity to other people's suffering, their ability to do service in the world, so many of the good things about them and their personalities and their sense of responsibility to others comes from the fact that their mom got really sick. But I also know that if there were a door I could walk through and not have had that diagnosis, there's no way I wouldn't walk through that door. I wish that there were another way that they could have become the remarkable, generous young women that they are.
I'd love to talk about your advocacy to help a more diverse population have access to clinical trials. What do you say to patients who don't have the kind of access that you did? You were in a big city, you were going to a very well-known research center. What do you say to those patients?
I think talking to patients is the hardest part of it. It's much easier for me to try to shake the system by the shoulders and say, you need to fix yourself and you need to do better and you need to do right by patients. It is hard to talk to patients about these things because the reality of our lives is that many of us really do have to work within very, very profound limitations. Searching for clinical trials is the most onerous task in the world. There is almost no easy, simple, clear language way to do it. Having conversations with doctors is often really hard. And what I do try to do is be sensitive to that and understand that very few people have the kinds of options that I had. Very few people can say, I don't like what this doctor is telling me, I'm going to go to another. Very few people can say, I heard about a clinical trial that's 200 miles away and I'm going to try and enroll in it. So all I can do is say to them, I get that. Sometimes just being able to sit with other people and the experience and say, I know it's hard, is the best that you can do, is all that you can do. I certainly encourage patients to educate themselves, to do what they can, to have their caregivers educate them, to make sure that they have a squad, whoever it may be. It may not be the people you think it's going to be. Sometimes the people you thought were going to be your ride or die are not your ride or die, but you will find your team. You will find the people who can be there for you. To look for other people, not necessarily who have had cancer, but who have been through something really hard, who have really had to go through a difficult, traumatic, life-changing experience, and ask them how they did it. It doesn't have to be cancer necessarily. It just has to be, how did you get through? How did you get food on the table during this? How did you make sure that you had enough toilet paper in the linen closet? Just little practical things like that, because those are the things that get lost along the way. And make sure that you have an action plan for your life. I can speak to that better than I can to speaking to the cancer treatment itself, which may be, for some people, really, really limited. But all of us need help just getting dinner on the table, getting the laundry done, making sure there's toilet paper in the linen closet. And that's something that every patient needs to be thinking about.
Do you continue to follow the immuno-oncology advances? I imagine as a journalist with an inquisitive nature, you do.
Oh, of course. I'm absolutely fascinated with what's going on in immuno-oncology right now. I'm really deeply heartened by the progress that's being made across other types of cancers. and have seen the outcomes that there are, I'm also really closely following what we are trying to do to make these breakthroughs accessible to more people, to making them more affordable, to really interrogating the process as it trickles down into smaller clinics and to smaller practices. When patients reach out to me and tell me about their immuno-oncology experiences, I never tell them what to do, but I hope I can give them some questions to ask their providers about what the game plan is, what the endpoints might be, what they're looking out for. I'm really hopeful that this will change. And I'm also really hopeful about getting the right information and true information out there, because there's also so much misinformation right now. We live in an age where people are Googling and posting on Facebook things that just aren't true. And it's very, very difficult to distinguish that from real information and accurate information. And I feel very strongly that all of us need to be skeptical and rigorous and really look into where information is coming from and what the source is and how trustworthy it is.
Would you like to talk about more of your advocacy work, such as you're a member of the Stand Up to Cancer's Immunotherapy Dream Team? I know you speak for other organizations as well.
I feel like I have been granted so many privileges. I realize that when it comes to cancer, I was born on third base. I know that. I know that I got lucky in so many ways based on where I live, the level of education I have, the kind of insurance that I have, the access to information that I have. So I feel it's absolutely my responsibility now to take a glance back and look at the people who are coming into this world of cancer and ask what I can do for them, and ask myself, where are the points of opportunity to just be a helper? And the fact is, I'm not good at math and science. I never will be. I can't heal on that level. I can't be part of that. What I hope that I can do most of all is just talk to people and just listen to people and point out where I know that as a patient, I see deficiencies. And I know that what we need most of all, really, as patients, is a strong support system and clear communication and empathetic communication. And whether that comes from working with support organizations like Builders Club or some of the other organizations that I work with, and I'm really proud to work with, it really is not about me as yet another privileged white lady telling my story of how I got sick and how I got better, but really saying, I am an unusual circumstance. I am not a typical cancer patient. I am not a typical outcome. Even now, 8 years later, my outcome and my experience is not typical, and that needs to change. And what I have to do as someone who has all of my privileges is be sensitive to that and try to listen more than I talk.
Finally, what gets you out of bed in the morning?
Well, I live in New York City, so what gets me out of bed in the morning is usually the sound of garbage trucks. That's generally how that works. What gets me out of bed in the morning is that I hope that every day there's something new to learn, that the work is never finished, that the work is never perfect. I always remember one of my doctors very early on just saying very simply, there's always more we can do. And there is always more we can do. So as long as there's more we can do, then every sunrise is a challenge to do it. Whether that means trying to encourage doctors to be more sensitive, encourage researchers to change the parameters of clinical trials, to advocate for more compassionate use for patients, or very, very often to just be the person who listens and says, that sounds really hard. I'm sorry. And that's what gets me out of bed. Because sometimes, in fact, every day, someone needs to hear that. Just that. I don't need to fix it. I don't need to change it. I just need to hear it. I just need to be the person who says, that sounds really hard and I'm sorry.
We'd like to thank Mary Elizabeth Williams for sharing her story and for her advocacy for the oncology community. Thank you for joining us and supporting Cancer Buzz. If you're enjoying the show, please share it with your colleagues and leave us a review. Help us spread the word about the show. Next time on Cancer Buzz, we tackle payment for supportive care services in value-based healthcare. That's a show you won't want to miss, so be sure to hit the subscribe button and have that show delivered right to you at the end of the month. Until then, for the entire Cancer Buzz team, I'm Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.